Let's spend some time talking about fractures. Closed or simple fractures are fractures which the skin remains intact. Open or compound fractures involve wounds that communicate with the fracture and expose bone to contamination. Open fractures have a high risk of osteomyelitis or bone infection. So compound fractures are open fractures. Do not confuse compound with comminuted, and we'll talk about that in a little bit. Here is a photograph and an x-ray of a compound fracture, otherwise known as an open fracture. And these are very high risk for bone infection. A complete fracture is a fracture in which the bone fragments separate completely. An incomplete or green stick fracture is a fracture in which the bone fragments are still partially joined. So if you took a twig off of a tree and snapped it, you'll notice many times that part of the twig remains intact while the other part of the twig breaks, and that's where the term green stick comes from. And we see these more in children who still have softer bones. A linear fracture is a fracture that is parallel to the bone's long axis. A transverse fracture is a fracture that is at a right angle to the bone's long axis. An oblique fracture is a fracture that is diagonal to the bone's long axis. A spiral fracture is a fracture where at least one part of the bone has been twisted. So certain injuries that have twisting motions can result in spiral fractures. A compression fracture is a fracture caused when bone fragments are driven into each other. A displaced fracture is a fracture where the bone's fragments are out of alignment with each other. An angulated fracture is a fracture where the bone's fragments are at angles with each other. A comminuted fracture is a fracture where there are multiple bone fragments. Do not confuse comminuted fractures with compound or open fractures. So here's a picture of some typical bone fractures. We talked about green stick, incomplete fracture. We talked about spiral fractures. We talked about comminuted fractures where there are multiple pieces. Transverse fracture, which is at a right angle to the bone's long axis. Compound or open fractures are at high risk for bone infection. Do not confuse compound with comminuted. And here we see a vertebral compression fracture where either end of the vertebra have been pushed into each other. I don't expect you to know the 5 different types of Salter-Harris fractures, but I did want you to know that Salter-Harris fractures involve fractures across the growth plate. This is especially concerning in young children because their bones are still growing at the epiphyseal plates, and so a fracture that destroys the epiphyseal plate will interfere with the growth of the bone. So Salter-Harris fractures are especially concerning in children, and these Salter-Harris fractures are named by how much involvement of the growth plate is involved. So when we talk about complications of fractures, we want to think about the bones involved and the surrounding organs. The cranium encases the brain. The cranium is the part of the skull that encases the brain. So because the cranium protects the brain, fractures of the cranium can result in brain damage and bleeding around the brain as well. And here I have a little black line outlining the fracture. See if you can see this. A depressed skull fracture means there's a skull fragment depressed into the cranium, and these result in brain damage and blood vessel damage. Even a small amount of depression in a skull fracture requires surgical intervention. And here is what's known as a CT bone window. CT of the head, the person is facing upright, and it's designed to show the bone, and we can see a severely depressed skull fracture here. Well, because an infant's brain and skull are rapidly growing, skull fractures in young children need to be reevaluated to make sure the fracture does not expand. So let's talk about facial fractures. I like to divide the skull into the cranium, the part that protects the brain, and then the face, where the face and the brain case, the cranium meet. We call that the skull base. And so where the cranium meets the neck and the face, all of that is the skull base. Orbital fractures are fractures of the bones around the eyes. So orbital fractures can affect eye movement and result in double vision. And they can also affect the skull base, meaning basilar skull fracture. Maxillary fractures can allow air and bacteria from the sinuses to escape into the skin. That's why people who've had maxillary and other facial fractures are told not to blow their nose because they can release air into the skin and cause infection, worsening of the fracture as well. I don't expect you to know the different types of Le Fort fractures, but I did want you to know that Le Fort fractures are types of fractures of the maxilla and the face. And so here we see a Le Fort fracture which goes across the face. This is Le Fort fracture type 1. And here is a reconstructed CAT scan in 3 dimensions of the bones, and we can see this person has a Le Fort fracture type 1 across the maxilla. But remember, where your brain case and your face meet is the skull base, and so here are more severe types of maxillary and facial fractures, Le Fort 2 and 3, and you can see Le Fort 3 is a fracture that extends back into the posterior orbits and can be considered a basilar skull fracture. So raccoon eyes is invariably due to basilar skull fracture. It looks like this person has been beat up and has black eyes, but that's not the case at all. These raccoon eyes are due to basilar skull fracture. When somebody is hit in the face to cause a black eye, then we'll see the bruising or ecchymosis begin at the orbital ridge and the ridge of the cheekbone, the periorbital ridges. And we see that his bruising, his ecchymosis, does not begin at the periorbital ridges. His ecchymosis seems to be coming from inside of his eyelids. And so the base of the brain, when it bleeds, communicates with the space that's well demarcated here because there is fascia attached to the skull which does not allow the blood to extend up above the eyelids. That's why we see this very well demarcated bruising. And the blood that is pressing, the blood that is in the eyelids is compressing the surrounding tissue, and that blanches the surrounding tissue, meaning that the blood cannot get into the surrounding tissue. And that's where this white stripe that seems to go around the ecchymosis or bruising indicates. And so this is where the word raccoon eyes comes from, the blackened eyelids with that surrounding blanching or white of the skin. And so raccoon eyes is invariably due to basilar skull fracture. Battle sign or ethmoid ecchymosis is another sign of basilar skull fracture. And here is another battle sign indicating basilar skull fracture. We see the bruising right here. So any skull fracture, especially fractures of the skull base, can result in intracranial hemorrhage, brain damage, and cerebrospinal fluid leaks as well. So somebody who's had any kind of head trauma who develops a runny nose, we worry about cerebrospinal fluid leak coming from a skull fracture, because this can result in meningitis, an infection of the tissue surrounding the brain. When we talk about spinal fractures, we need to think about the spinal column. The spinal column is the bones of the spine. The spinal cord is the neurologic structure that runs inside of the spinal column. So the spinal column has two functions: to support weight, to support the upright body, and to protect the spinal cord. Please do not confuse the term spinal cord with spinal column. Spinal column is the bones. Spinal cord is the neurologic structure that runs inside of the spinal column. And so here we see vertebra, the bones of the spinal column, protecting the spinal cord that runs inside of the spinal column. So remember, the spinal column supports weight and protects the spinal cord. And here's another cartoon. We see the body of the vertebra, and we can see the spinal canal where the spinal cord will run. So not all spinal fractures interfere with support. And so as long as the spinal fracture does not interfere with support, we call it stable. So maybe a fracture of the spinous process is not going to interfere with the support of the spine. And so we can consider those to be stable fractures because the spine is still able to bear weight. But spinal fractures that result in a failure to support are considered unstable. And here is a fracture of the vertebral body, and we can see that the ability to support has been lost. This can be considered an unstable cervical fracture. Here's an example of a compression fracture of the spine, and these are rather common, especially in older people. But when the fracture results in dislocation, notice we have tearing of certain ligaments, and that causes the vertebral column not to be able to support weight, and this can become an unstable fracture. But most compression fractures are stable fractures. Well, this is obviously a post-mortem x-ray because this person would be wearing a C-collar during this x-ray. And so this person has suffered a spinal fracture that has caused complete transection of the spinal cord. The spinal vertebra should line up right on top of each other, and we can see that this one is anterior dislocated severely, causing a complete transection of the spinal cord. And if that does not result in death, that can certainly result in paralysis and weakness. And here I've drawn for you the path that the spinal cord takes through the vertebral column, and here we can see that this injury would result in complete transection.